the World Health Organization is reporting that the number of coronavirus cases and deaths in Africa have dropped to their lowest levels since the pandemic began. But the WHO is warning that coronavirus is far from being endemic. Let's talk about this with Dr Aslam Dasoo, convener of the Progressive Health Forum. Doctor, always good to have you on Newzroom Afrika. So the numbers are lower than they've been since the start of the pandemic, yet we're far from COVID-19 becoming endemic. What then do we call this phase in the battle against COVID?
Good afternoon, Tamikila, and thank you for inviting me. I think, unfortunately, when we have these news reports coming out, they're often decontextualized. Both are correct, of course, that the low numbers we are experiencing across the continent, we can see this certainly in South Africa, is a result in the ebb of the pandemic. But as we know, there will be a flow again, there will be a wave. And these numbers will increase, as certainly in Southern Africa, as we approach the winter, when we are expecting a fifth wave. On the other hand, the term endemicity is an epidemiological term, and it's not a generalized consideration. When a pathogen like this virus becomes endemic, we pretty much know it. It becomes seasonal, we can predict its outbreaks, and we can manage it. At this point, we are very much still in the pandemic, very much so. And I think the WHO is right to urge caution at this time.
And the WHO warns of exactly what you were just saying, that we're going now, the Southern Hemisphere is going to the winter months, and that's when we're likely to see a further spike. What then do the respective governments do, given that, A, vaccination numbers are still low, there are still questions around just how many people have natural immunity from previous infection, etc.?
Okay, so let's take the South African situation to provide context to that. So we have about 40% of the population vaccinated and just over 30% fully vaccinated. During the Omicron wave, with high transmission, our existing immunity from natural infection, which was already high following the Delta wave of about 80%, went up close to 90%. And in other words, we can understand why, even though there were a huge number of cases with Omicron, there were so few hospitalizations and deaths. And that is a result of existing population immunity. Now, that won't last, because we know, that both vaccines and natural immunity wanes over time. And so, for authorities, the situation, I think, is pretty clear, that we have to increase the rate of vaccination dramatically, and we have to maintain such measures, and this I can't stress enough. It doesn't need law to prevent us from getting infected. We are all, shall I call us now, pandemic veterans. We know the common sense things. Wear a mask when you're indoors in public spaces, and keep your hands clean with soap and water. You can forget all the alcohol, hygiene, theater, and vaccinate. And really, there's nothing else in the toolkit right now. So I think it really is now up to us to maintain, as best we can, a situation where we don't get infected. Because even if you do get infected and it's mild or moderate, you're still at risk for developing long COVID. So the idea is not to get infected. I think it's also important to stress that while the global vaccination rate is about 11 billion at this point, the vast majority are in the Northern Hemisphere, China, and India. Africa's vaccination rate still is hovering around 12%. And we also have very poor reporting systems in many countries. So we don't really know the impact of the previous waves and how many deaths. And in fact, we have poor administrative systems that can't manage the vaccination rollout, especially with mRNA vaccines, which requires a lot of infrastructure. Mm-hmm. So Africa is really at risk, and I think it behoves governments, certainly ours and those with means, to rapidly escalate vaccination in order to prevent severe disease and death.
And just South Africa, but Africa as a whole has fared much better than other parts of the world based on the available data in terms of COVID-19. Do you think there's been a gross underestimation, a gross undercalculation that is unique to Africa?
there has been an undercalculation for sure. The reporting, as I said, is a huge undercount. And just the global average, for example, saying that, some 500 million people have been infected. Actually, you can multiply that by 10. And for those who have died, we say there's only about 6 million who have perished during this pandemic globally, but you can multiply that by 3. And so we also can understand, and we can extrapolate that certainly to South Africa and other countries in Africa. And I think we must not be guided simply by the numbers here. I think as time passes and people finally tabulate the casualties of COVID, we'll find those numbers hugely revised upwards. Mm-hmm. At the moment, we have only one duty here. We must vaccinate as many people as possible and, of course, provide them with information on and the ability to keep themselves safe. We're not fighting a war here. If you think you're fighting a war against this virus, you've already lost. The virus, it's actually worse than that. The virus is indifferent to us. And all we can do is protect ourselves from it. So you need to vaccinate. You need to take care when you're in crowded spaces. Wear a mask. It works, and wear a proper mask. We're not talking about cloth masks. We should wear basic medical grade masks at least to ensure that is effective as well. But mostly, understand very clearly we're going to be going through the 5th wave, perhaps a 6th one, and maybe this year we will pivot at some point out of the emergency phase towards early endemicity. But to say we are aiming to become endemic at a particular moment, that will need very specific conditions to be met, and we are very far from meeting those.
And Dr. Dasoo, you were saying earlier that we don't need government rules, right, to move forward with COVID-19, and the caution that even the WHO says is still necessary at this point because we are still very much in a pandemic. How then do you explain the nervousness on the part of governments such as in South Africa, where there's very much a feeling that while the rules aren't being used to clamp down, according to government, on people's rights, there is a fear that without any rules, the situation could rapidly get out of control?
Well, that may be the case in certain other instances of natural calamities. It's not the case now. There's very little to suggest that we would face an exigency where the pandemic becomes rampant again, as it did in, say, 2020. We know now that with increasing vaccination, increasing immunity, even from natural infection, which is a very expensive way of getting your immune system prepared. But even with that, we know that future variants will probably not be worse than Omicron. And in the unlikely event that we do come across a variant that is able to evade our current immunity, perhaps evade vaccines, and I must stress it's a highly unlikely possibility, even then, the state has sufficient power to act appropriately to manage the situation. I think you are referring to these draft regulations that have been put out. Mm-hmm. These draft regulations are just a cut and paste from the Disaster Management Act. And I'm not sure why the government went this way. Clearly, there's no scientific basis for most of these regulations. We do expect that we must manage this as a public health emergency, so it's appropriate that it's managed under the National Health Act. We don't need a Disaster Management Act to manage that. That's what you use, say, in the floods in KZN, not to manage a multi-year pandemic. This is a public health matter. The National Health Act perhaps needs to be amended to give the minister and the executive the ability to act with precision when and if that is necessary at any given moment. But as things stand right now, those regulations are unnecessary. And really, as South Africans, we've been through this now for a long time. We need to just apply common sense to this. We understand how this thing works. We understand how it transmits. So take the necessary measures to protect yourself. That's the way we are going to get through this, of course, and for the state to ramp up its vaccination program, which has spluttered to a halt now. And I think that's partly because it's so tightly controlled, where it doesn't need to be. We need to get vaccines out widely. We need to increase the range of vaccines we are providing. Rural areas can't manage the Pfizer vaccine. They can barely manage looking after the J&J vaccine, whose conditions of storage are less stringent. There are other vaccines now that we have approved, like the Sinopharm vaccine, which is an inactive vaccine, and it's it's got a long shelf life, can be used in rural settings very easily. But we do need to engage our population in a far more organic way to make them understand why it's necessary to take these vaccinations.